Here today with a good friend, Professor David Nash from Thomas Jefferson University. I'll let him introduce himself. He doesn't need an introduction. Actually, he's world recognized for his remarkable career in healthcare. So, David, we would like to hear about your most recent book, How COVID Crashed the System, and a Guide to Fixing American Healthcare, because we think it's a possible solution for Brazilian healthcare as well.
Well, first of all, Vanessa, wonderful to be together. Thank you. It's my first visit to Brazil, your wonderful country, first time in Sao Paulo, so thank you so much. Great to be with colleagues yesterday at wonderful Albert Einstein Medical Center, fantastic. And my wife, Esther, also a physician, is here with me, so we have had a great visit. So let me tell you about Jefferson just for a moment. So I am a professor of health policy. Jefferson University is in Philadelphia in the United States. I have been on the faculty at Jefferson for 33 years, a long time. And part of my previous job was as the first dean of the first College of Population Health in the United States. So public health, obviously, still very, very important. But our college was focused on not only the core competencies in public health, but also in healthcare quality and safety, something I know you care a lot about.
Yeah.
We're also focused on health economics, on population health analytics, and on the theories of population health as well. So the way we like to think of it is population health is the roof of the house, and public health and economics and quality and safety and analytics are the pillars that hold up the roof. And that's what our school is all about. I'm very proud of what Jefferson has done to make a commitment to population health. It was not popular, and we opened the doors to our college in September 2009, so now almost 14 years ago, and I was dean for the first 11 years of that time. Now I'm back on the faculty doing my own work, and part of that work was to write How COVID Crashed the System, along with my colleague Charles Wolforth, who is a science writer in Princeton, New Jersey, not far from Philadelphia. So what is our book about? It's a very fascinating, important, and maybe vexing story. The analogy we made was that the U.S. healthcare system was an airplane, and COVID made it crash, and that Charles and I are the investigators crawling over the smoking wreckage, and it's a terrible sight, and there's dead bodies, and we're looking for the black box, but yet we actually know what's in the black box, right? And so what did we find? Well, we found disparities and inequality in care. We found poverty. We found lack of primary care. We found a industry, the healthcare industry in America, the largest industry in America. 20% of the GDP of the biggest economic engine in the world.
Yeah.
$4 trillion a year. And COVID, a tiny, tiny virus, crashed the biggest industry in the richest country in the world. How come? And 1.2 million Americans died. On a per capita basis, worse than any other country in the world. So the richest nation had the worst outcome. That's why we came up with the title, How It Crashed the System. So back to the black box, we could spend a long time just what did the black box show? And again, I think the issues are lack of access, lack of primary care, total lack of coordination of the system. And in the beginning of COVID, of course, no testing, and the politics in America very polarized. And of course, at the bedside, at Einstein, at Jefferson, my own daughter was at the bedside as a doctor. there was amazing heroism and amazing commitment to work. But the real story is not what happened at the bedside. The real story is the greater picture of how Brazil's society and our society had some important failures. And that's really what the book is all about. And the first half is very sad. The second half is better.
And I enjoyed the book very much, and I really recommend the reading. And I think we have a lot of similarities in the sense that we have a lot of inequities, and we don't really have a lot of information about it in Brazil. So we were discussing this yesterday, how employers should be aware of the difficulties their employees are suffering. We should collect data on social determinants of health, because many times this is a better way to change the health of the population than doing other initiatives, right?
Absolutely. I think in America, the term social determinants of health, certainly our college and many other organizations made this a more popular term, but let's remember, even 5 years ago, no one was really talking about the social determinants. Let's talk about Philadelphia, the 5th largest city in America, the birthplace of our country, the Liberty Bell, Independence Place, good history. And my office is 4 blocks from all of that. But Philadelphia, it also has a terrible problem where roughly 1/4 of the population lives in poverty. And half of that group lives in what we call deep poverty, meaning they can't feed their children. The daily activities are all at risk. It's a horrible situation. And what COVID pointed out, like shining a bright spotlight on this problem, that if you are poor, you are at greater risk. And of course, it turned out in Philadelphia and across all of America, disproportionate, terrible outcomes, more deaths in populations of color, most especially in America, Black population, Latino population, multi-generational houses, lack of health insurance. Brazil has universal coverage. America does not. So still 30 million Americans have no insurance at all, and another 20 to 30 million have inadequate coverage, and very few people have a primary care doctor who he or she could communicate and connect. So all of those problems, both the disparities, the inequality, just amplified the problem. And that's why bus drivers and grocery workers and sanitation workers had very high death rates, especially for the first year and before the vaccine. So you're right, the social determinants were a great predictor of a bad outcome, not just in Philadelphia, but especially in America's big cities. The worst would probably be New York and Los Angeles, California, where we needed morgue trucks, refrigerated trucks to literally pile up the bodies. I mean, can you imagine?
That's unbelievable.
Unbelievable. Now, if that happened in a wealthy community, America would say, my goodness, what's wrong? So some of this is also, we have to admit, is racism, that as these folks died, it took a long time for society to say, well, this is not right, and we're going to need to do something. So one of the reasons I'm still working after 33 years is not only to write the book, Come and See You and Your Famous Father, but to try to find maybe not the answer, but to continue the conversation about what can we do for next time. And whether we have another pandemic or not is not the question. The question is, what did we learn? And can we improve and do a better job? Jefferson on the delivery side is 15 hospitals, a gigantic system, a major employer in Philadelphia, and a very important part of the economic engine. So we have a lot to learn, and I'm like to think of myself as an agitator for change, that if we just keep doing the same thing we did before COVID, well, we're not going to improve anything.
Exactly.
So we need a new model of care, and we need better primary care. We need better connection to the community, and we are working on each of these areas, but it's not a switch that you could throw and all of a sudden it's fixed. It's going to take time to change some very old habits.
Yes, I agree. And in Brazil, although we have this public healthcare system that covers 100% of the population, those that have private insurance, that it's around 26% of the population, don't usually use the public system.
Sure.
And in the private system, we have similar problems to what you described in the book in terms of lack of coordination of care, overutilization. We don't have the culture of using primary care before going to a specialist.
Right.
And I'd like to talk a little bit about this, but also start thinking about the solutions you proposed as well.
Great. Well, as I said, the first half of the book is very sad. A million dead, that's more casualties than all of the wars America has fought since the Revolutionary War. And Philadelphia, of course, was our first capital. So, it's particularly amazing from a historical point of view. So some solutions. Well, look, I think given that this is MIT, something I'm so proud of, and you don't remember, but my late father was in the very first class at the Sloan School of Management.
That's amazing.
Right? And I have a picture of my father sitting with Albert Sloan at a dinner, pretty incredible. So MIT, very important in our family. I have one sibling, a younger brother, cardiologist, who went to the Harvard-MIT joint program. So MIT, Nash family, deep connection. So what are some of the solutions? Look, I think tackling poverty and reaching into the community. So you can't have value without improving equity and reducing disparity. So this now needs to become one of our top jobs. I think the second thing that we talk about, and certainly because this is MIT, is leadership, right? So how are we going to train the doctor, nurse, pharmacist, and administrator of the future so she'll be better prepared to tackle a problem like a pandemic? So that means they need to understand what you're an expert in, the social determinants, the economic impact, improving access. So I think the second potential solution is leadership training that's focused on these issues. I think a third area is change the economic incentives. I'm excited to be here today to talk about that at the broader forum. And when we say that, at least in America, we mean align the incentive so we're focused on what others have called the true north, meaning what is the real business that we're in? And I believe the business we're in is to improve health. However, if you look at the evidence, we have failed to improve health in America for sure. Pre-COVID, lifespan in America was going backwards. Crazy. 2018, 2019, the four horses of the social apocalypse, right? Drug abuse, suicide, alcoholism, depression. Terrible. COVID made these four problems far worse. We had in Philadelphia terrible issues, domestic violence, alcoholism, a very sad story. So I think another part of the solution is, what is the social network that we're going to build? Is it jobs? Is it job training? Is it changing how we, what the welfare state looks like? So these are not clinical solutions, these are social solutions. So let's make a list. It's complicated.
Yes.
One is certainly tackling poverty and reducing disparities and inequality in care. 2, for me, improving leadership. 3, changing the payment system. And very important to me personally is education. Not only education in our, public schools, just like in Brazil, and we have the similar challenges, public versus private, and all of the issues there. But I mean also education for building, as I said, the doctor, pharmacist, and nurse of the future. How can we change the curriculum? And we give specific recommendations in the second half of the book about changing that. So those are the 4 top areas that we need to work. For me, leadership is always the most important.
Yes.
Because that is the key for everything. And sadly, in our country especially, we have a polarization in our leadership. And only in America, if you live in the state that had a red governor, your outcomes from COVID were far worse than if you lived in a state like I do, Pennsylvania, with a blue governor, that our outcomes are better. Crazy. It should not matter what your geography is. Everyone should have equal access to, improved health. So that's what we tried to summarize. It was a privilege to work with Charles and to do this hard work during COVID. I learned a lot. I'm very lucky that I could stay in my home office and do the research, and I was no longer at the bedside. So good timing, to be able to do that. I'm grateful to my clinical colleagues who literally risked their lives at the beginning of COVID especially. I'm sad that not everybody got a vaccine, even though America led the world, right, at warp speed to create vaccines that were very effective. I wish everybody had had one.
Yeah.
So these are issues still that we have to tackle.
Yeah, unfortunately, we had similar problems in terms of political disturbances and impacts on outcomes in Brazil as well. And I think we could finalize talking a little bit about technology, because we had a big development, for example, in telehealth. And I think that's a way to increase access, for example, to specialists.
Right.
On the other hand, we talked a little bit as well yesterday about the thing that we focus so much on technology and we spend so much money on technology that sometimes we forget about what would be basic in healthcare. How can we balance that?
Absolutely. Well, let me tell you a story. Our leadership at Jefferson was committed to telemedicine before the pandemic. We had an infrastructure and very well-known doctors in America who helped create the curriculum for telemedicine. So we were ready to tackle it, but what we didn't think about necessarily was the fact that the 1/4 of the population who live in poverty, well, they don't have access to the internet. Maybe they have a cell phone, but it's episodic and they have to get a new card. And so for them to access the telemedicine, well, that was a real challenge. For middle-class people, it was an excellent use of technology. The only reason it became so popular during COVID was because Medicare, our largest government-paying program, decided almost overnight to pay for telehealth. It was almost a miracle that prior, no payment, COVID, of course, will pay. And so doctors got trained very quickly, and all of a sudden, everyone was doing telemedicine. As you know from Einstein, there's a talent to being a good doctor on telemedicine.
Yes.
I've never been trained, so I would have to learn how to do a good job using this technology. So I think between email and telemedicine And the entire movement in America we call hospital at home, all of the technology, blood pressure, oxygenation, all of that, really pretty remarkable. The digitization of care is another expression we use. I think the future will do many more things in the home environment. I'm looking forward to it.
Yes.
Going to the hospital is expensive, time-consuming, and in Philadelphia, very hard to find a parking spot. So I think telemedicine will be very important. Hospital at home, another big movement. I'm helping many companies in our country to focus on these issues. I know Einstein has the technology. So that's one step in the right direction.
So it's a big honor to be here, as I told
Pleasure.
you. Very good. Thank you for the conversation we had today.
Great to be together.
It's always inspiring. Thank you.
Thank you again.